Hi, I'm Rachel Janbeck, Environmental Health Division Manager with the Pasadena Public Health Department, and today we are talking about COVID in the workplace. Our health inspectors, who typically inspect restaurants, grocery stores, and public pools, are also working right now with business operators to ensure measures are taken to prevent or reduce the spread of COVID in their establishment. A common question that we receive from business owners is, why are we seeing COVID cases in our facility? We've implemented all the protocols. We did everything we were asked to do, and we have a case. One contributing factor is that although you are creating a safe and controlled environment at your workplace, employees may be doing riskier behaviors outside of work, such as meeting with individuals while not wearing face coverings or not physically distancing. Another factor to be aware of is that some transmission occurs asymptomatically. This means that persons who are showing no symptoms can be infectious. When this occurs in our workplace, it may go undetected at first. This virus spreads easily. In any environment where persons from different households come together, there's risk. The purpose of the operating protocols is to reduce COVID transmission in your establishment and hopefully to identify and slow the spread of the disease before it becomes a significant outbreak. The top 5 protocols that a business must implement during the COVID-19 pandemic include daily symptom checks, frequent hand washing, face coverings for employees and customers, physical distancing of employee workstations and customer waiting areas, and disinfection of frequently touched surfaces.
Hi, I'm Colton Tognazzini. I'm a public health nurse with the Pasadena Public Health Department. I want to take a moment to talk about what to expect if you have one case of COVID-19 among your employees or patrons. The health department is here to advise and guide you on best practices. As part of this, we want to be your partner during the pandemic. The sooner you're able to reach out to us, the more effective we can all be at slowing the spread of COVID-19 within your business and within our community. We want to be part of employers' ongoing efforts to provide education to employees on what to do if they are sick or if a member of their family is sick. It is crucial that they know that they must stay home. For employees who test positive for COVID-19, it's important that they remain in home isolation so long as they don't need to be hospitalized. In-home isolation is a legal requirement to stay home for 10 days or longer if they still have a fever or other symptoms. Employees may have been exposed if they've had close contact with someone who has a laboratory-confirmed case of COVID-19. So what's a close contact? We define that as 15 minutes or more within approximately 6 feet or less. We count 15 minutes cumulatively over the course of the day and not consecutively. It's important to note that if one or both parties are wearing a mask, it does not preclude you from being categorized as a close contact to the laboratory-confirmed case. We will work with you to help determine which employees or patrons may have been exposed to the virus and what additional precautions you may need to take. During this entire time, we will always maintain confidentiality as required by the Americans with Disabilities Act.
Hi, my name is Dr. Matt Feaster, and I am your epidemiologist for the city of Pasadena. I'm here today to tell you we are here for you if you suspect your business or workplace has a cluster or outbreak of COVID-19. Employers can be their biggest help or hindrance in preventing the spread of COVID-19. So here are a few tips to be prepared. If you suspect more than one case of COVID-19 in your workplace, call us. It is important to work with us to determine which employees may have been exposed to the virus and what additional precautions can be taken. Through this process, it is imperative to maintain your employees' confidentiality at all times. Employers should provide education to employees on what to do if they're sick. Employees who test positive for COVID-19 must remain in home isolation for their full 10 days, even if they're asymptomatic. They should only return after they have elapsed their 10 days since symptom onset and when their symptoms have significantly improved, if they were symptomatic. If you have an employee who tests positive for COVID-19, it is likely we will be doing contact tracing among other employees. An employee is a close contact if they had prolonged contact, meaning 15 minutes or more of contact within 6 feet. If they meet this threshold, we will mandate they go into quarantine. Their quarantine will be for 14 days regardless of any interim test results, and even if they're asymptomatic. If an employee tests within that 14-day period, there is still a high likelihood of a false negative COVID-19 test, and they can still go on to become infectious. During an outbreak or cluster, several employees may be placed into quarantine or isolation. Workplaces should follow the public health recommendations for community-related exposure and instruct potentially exposed employees to stay home for the health department mandated amount of time, telework if possible, and self-monitor for symptoms. All other employees should still self-monitor for symptoms and wear cloth face coverings when in public. Managers should enforce face coverings and monitor break rooms or where employees congregate to ensure employees do not fraternize with the masks off. We've had several outbreaks start in this way. If employees develop symptoms while at work, they should notify their supervisors safely and go home immediately. For laboratory confirmed COVID cases, in order to go back to work, an employee needs to file a return to work request with the public health department that can be found on our website at cityofpasadena.net. Finally, if you suspect more than one case of COVID-19 in your workplace, you should call us at 626-744-6089 or email us at nursing@cityofpasadena.net.
Hi, my name is Vivian Gonzalez, and I am the Community Health Services Division Manager for the City of Pasadena. I'm going to review with you today what employers are obligated to provide. First, employers should review the detailed guidance for your industry on our website, cityofpasadena.net. There are specific requirements on what you will need to provide to the health department. For example, personal care services such as salons are requested to provide information about client personnel records, shift, attendance logs, and facility floor plans as quickly as possible to the health department. When submitting the requested information, please include accurate information such as phone numbers, addresses, and emails for all visitors and staff who were within 6 feet of contact of the infectious person for 15 minutes or more. This is also a friendly reminder that interviews with our community members are voluntary, but employer participation is required. We will ask for information items such as employee rosters, client list, facility maps, etc. that are relevant to our investigations and which the health department is legally entitled to. Employers must implement the measures recommended by the health department. We care about you and your employees, and we want to remind you the best way to slow the spread of COVID-19 is to follow the 3 W's. Wash your hands, wear your face coverings, and watch your distance. And for employers, a 4th W. Work with us. We're here. We want to ensure we minimize the spread of COVID-19. And lastly, as flu season approaches, it's so important we get our flu vaccine. So please get your flu shot. Thank you, Pasadena. We're here to serve you.